How does a child get diagnosed with autism? My name is Katie. I'm a pediatric speech language pathologist, and I help parents become more confident in understanding their children's speech and language development. As a speech therapist, I do have a lot of autistic patients on my caseload, and many of those patients I have helped parents obtain a referral for, and I have helped parents get a diagnosis for their autistic children. If you have any inkling that you feel like your child may have characteristics of autism, I want you to express your concerns to your child's pediatrician right away. Waiting is probably one of the worst things you can do whenever you suspect that something may not be typically developing in your child. Now, depending on what different types of characteristics you observe or your child's pediatrician observes, they should be making a appropriate recommendation or referral over to a specialist who can best help your child. Typically, the specialists that are going to be able to diagnose autism in children are developmental pediatricians and neurologists. Typically, pediatricians will send over children that have speech delays, which is a very, very, very common characteristic of autism, but it does not mean that your child does have autism just if they have a language or a speech delay. There has to be more characteristics that are shown that are not typical of typical development in order to be classified as a child who does have autism. Within the first 5 minutes or less of meeting a child for the first time, and I speak for many speech therapists, experienced speech therapists, when I say this, I can tell whether or not a child has autism. Now, I can't diagnose them, but I can recognize signs of autism in children very quickly because I have been doing this for so long and because I have seen so many kids on my caseload who do have autism, and I do know so many different ways that autism can present itself. If I do notice that a child has any of these characteristics that do align with autism, I do bring them up to the parent right away, right when I suspect that there may be something else that's going on, and we talk about what we're going to do next. And typically the steps that we take next is a referral over to a developmental pediatrician. Once the developmental appointment is obtained, that appointment can take a while. I'm talking like probably longer than an hour because the developmental pediatrician is taking a really in-depth look at your child from head to toe, covering all bases, all medical history, so many different aspects they cover in order to properly diagnose your child if they do indeed require a diagnosis or meet specific characteristics that align with a specific diagnosis.